Dr. Shluper, you do see children in your practice. Am I correct there?
Yes, I do see children. Yeah.
Good. Dr. Shluper, tell me, let's say a mom, first newborn baby, and she doesn't quite know, what's happening, and when should she come to the dentist the first time with the baby? Why should she come? And are there any things you have to tell us about what a mom at home with their baby should do or shouldn't do to kind of start off at the right foot in terms of dental health for that newborn?
Yes. First of all, the baby teeth should be checked. Should be checked to prevent any decay. The first appointment of the baby, the dentist, should be when he has his first tooth. Nothing wrong with checking the baby teeth to see if everything is okay. Not necessarily anything has have to be done to those teeth.
It's probably better to do nothing because the child just gets used to that you play around, count the teeth. Maybe the child holds the mirror and gets used to the dental chair and basically it must be a much better experience than right away coming around with that drill on the first visit, right?
Yes. At the first visit, we even don't do anything. We're just getting to know the
person.
Yes.
Okay.
And he is not afraid of the dentist, does not afraid of coming to the dentist. And actually, he has a good time there.
Beautiful. Beautiful. Now, what should mom do at home before and after the child has maybe teeth? Is there something the mom should be knowing, immediately, like even before the first teeth are coming out? And what about thereafter? What should mom be paying attention to?
Well, the mom first should not say that anything is threatful or painful. There is nothing bad of going to a dentist. It's good.
That's what you say because you're a dentist. Try to tell that to us people. I'm kidding. I'm trying to be funny here. I know.
Usually dentistry is associated with pain and fear and expenses. That's unfortunately that's the association. But if we just avoid of associating those terms to a dental visit, it will change.
Okay,
and,
so good. So
in babies, so they have a fear right from the beginning. So
right.
If the mom does not say anything bad about going to the dentist, the baby will not be in fear.
Yeah, all right. So don't say if you don't eat your broccoli, we're going to the dentist. I got it. So what else? What should moms, when should they start brushing? Should they start brushing? Should they let the kid do it? Should they help them? Should they be worried about diet and drinking milk or kids has to drink milk, but in terms of like the sugar in it and stuff, is there things mom should pay attention to?
Yes, the mom should avoid of letting the baby sleep with the bottle, not only to prevent decay, but to distort of the growth of the bone. Usually we see grown-ups with some space between the upper and the lower teeth, and it turns that they were sleeping with a bottle.
And so that's because it somehow there's this lollipop in between, and it kind of distorts the teeth and stuff. And what is it about the other stuff you said with the bottle?
If the baby kept sleeping, sleeping at night with a bottle in, there are food and sugar in the food that is left overnight would create decay. Would create decay in the baby's teeth. So before the baby goes to bed, just make sure that he cleaned his teeth.
And then don't, because, obviously we learn that we need to clean our teeth before going to sleep, because otherwise the sugar, everything sits there the whole night. So if you give the baby a bottle, that the whole mouth is full with milk constantly, you're literally soaking the teeth in sugar and acid, which is what the milk is and or turns into it, right?
Yes, the microbes love that food.
Figures, sure. Okay, well, all right. Well, here we go. Anything else? Let me ask you this. Is it, the baby has the first teeth, and they started getting a little, maybe broken here and there, or something is happening. Is it important to maintain those first baby teeth or not? Because they're coming out anyway in a few years or in a short time.
Yes, it is important just in order to maintain the correct space for the adult tooth to grow underneath it.
Makes sense. That makes sense. So, so you don't want to just say, I'll lose it or so. If it's a little hurt, let's not put a filling in. Let's just put it out, because obviously there's probably a price difference or so. You do want to make sure that you maintain those teeth till they naturally come out, or till the dentist decides it needs to come out to make space for the right, for the permanent teeth in a correct way.
Yes, we do want to keep the space ready for the permanent tooth to grow in.
So again, like you keep saying that, your natural body parts are the best way to take care of your body, period. So what you're saying is, if you don't take care of the baby teeth, you might save a little bit of money. Never mind that your child maybe runs around with a hole in it and doesn't look so attractive, and children do want to look attractive also, from what I noticed. But at the same token, you might just have added $2,000, $3,000 or $4,000 to your orthodontic bill. Right?
So, you're right. So keep the baby teeth for as long as they should be there.
Mm-hmm.
You will save much more later.
Well, all right. Good. Well, again, very wonderful speaking to you. Thank you very much, Dr. Shluper.